right now. And Republicans continue with their usual theatrics with no regard for the deadly consequences.
Apparently, according to the CDC, vaccines don't work anymore. That science thing, inoperative.
We shouldn't have to say this, but that's an outright lie. The CDC has never said that vaccines don't work. Sharing dangerous and dubious information favored by COVID skeptics that represents a minority of the population. Here, just a few examples.
Democrats love to instill fear in the hearts of Americans. And I think Americans are really sick of this. They're over it. They're not going to comply. And you shouldn't comply with any more lockdowns, with any more mandates, none of it.
It's absolutely factual. The Delta variant is more transmissible, but far less deadly than the virus from last year.
The CDC issues a new proclamation. Apparently, according to the CDC, vaccines don't work anymore. That science thing, inoperative.
To be clear, to be crystal clear, the CDC never said vaccines don't work. Cruz's comments were so dangerous that Connecticut Senator Chris Murphy took to the Senate floor to rebuke his colleague by name.
Yesterday, I listened to a speech by Senator Cruz of Texas, and it was one of the most dangerous speeches that I've ever heard given on the Senate floor, and it deserves a response. Don't come to the Senate floor and make things up. Don't destroy people's reputations and careers with wild, unsubstantiated allegations about political motivations. The CDC doesn't get it right 100% of the time, but they don't have some secret political agenda.
Yet through their theatrics, these Republicans are misrepresenting the truth with very dangerous, even deadly consequences.
Dr. Fauci, knowing that it is a crime to lie to Congress, do you wish to retract your statement of May 11th where you claimed that the NIH never funded gain-of-function research in Wuhan?
Senator Paul, I have never lied before the Congress, and I do not retract that statement. This paper that you are referring to was judged by qualified staff up and down the chain as not being gain of function.
So
let me finish.
You take an animal virus and you increase its transmissibility to humans.
Right.
You're saying that's not gain of function?
Yeah, that is correct. And Senator Paul, you do not know what you are talking about, quite frankly. And I want to say that officially. You do not know what you are talking about. Okay, you get one person.
Let's read from the NIH definition of gain of function. This is your definition that you guys wrote. It says that scientific research that increases the transmissibility among mammals is gain of function. They took animal viruses that only occur in animals and they increased their transmissibility to humans. How you can say that is not gain of function?
It is not.
It's a dance, and you're dancing around this because you're trying to obscure responsibility for 4 million people dying around the world from a pandemic.
And let's let Dr. Fauci.
I have to, well, now you're getting into something. If the point that you are making is that the grant that was funded as a sub-award from EcoHealth to Wuhan created SARS-CoV-2. That's where you are getting. Let me finish.
We don't know.
Well,
we don't
wait
know
a minute.
If it did come from the lab, but all the evidence is pointing that it came from the lab, and there will be responsibility for those who funded the lab, including yourself.
I totally
This committee will allow the witness to respond.
I totally resent the lie that you are now propagating, Senator, because if you look at the viruses that were used in the experiments, that were given in the annual reports, that were published in the literature, it is molecularly impossible.
No one's saying those viruses caused it.
It
no
is
one is
molecularly.
Those viruses caused the pandemic. What we're alleging is that gain-of-function research was going on in that lab, and NIH funded it.
That is
you can't
not.
Get away from it. It meets your definition, and you are obfuscating the truth.
I'm not obfuscating the truth.
Senator
You are the
Paul's
one.
Time is expired, but I will allow the witness to.
Let me just finish. I want everyone to understand that if you look at those viruses, and that's judged by qualified virologists and evolutionary biologists, those viruses are molecularly impossible to result in SARS-CoV-2.
Viruses caused the pandemic. We're saying they are gain-of-function viruses because they were animal viruses that became more transmissible in human, and you funded it.
And you
admit the truth.
And you implying.
Senator Paul, your time has expired, and I will allow witnesses who come before this committee to respond.
And you are implying that what we did was responsible for the deaths of individual. I totally resent that. And if anybody is lying here, Senator, it is you.
But we begin the readout with an alarming and grim new portrait of the fight to contain the coronavirus. An internal CDC document urging officials to acknowledge the war has changed, warning that the new Delta variant appears to cause more severe illness and can spread as easily as chickenpox. It is more transmissible than Ebola, the common cold, the seasonal flu, and smallpox. And fully vaccinated people might spread the Delta variant at the same rate as unvaccinated people. The new data poses the greatest challenge yet to President Biden's COVID response messaging, which now includes measures to incentivize vaccinations and a requirement for federal employees. In the last day, the White House has made a shift from encouraging, or rather pleading with Americans to get vaccinated, to applying restrictions and inconveniences to those who won't. The shift marks a crucial point of the pandemic when cases are sweeping the country, with a fully vaccinated rate for those 12 and older at 57.9%. And still, the Republican-led revolt against any sort of mandate is escalating. On Thursday, House Republicans staged a maskless protest against protocols in Congress by walking to the Senate side, where masks are not mandated. While Republican governors, with a sweep of a pen, are taking aim at mask mandates in businesses and in schools. Joining me now, Dr. Erwin Redlener, public health analyst and founding director at the National Center for Disaster Preparedness at Columbia University, and Dr. Michael Saag of the Division of Infectious Disease at the University of Alabama at Birmingham. It is great to see you both. Dr. Redlener, I want to start with you. Just walk me through the findings as you understand them, because there is a lot to take in. What most concerns you?
So what most concerns me, Alicia, is that we started off thinking that vaccinated people would not carry the virus as much as unvaccinated people. It turns out that that's not true. That 75% of the cases, the newly determined cases of COVID, are actually among vaccinated people. So the bottom line here is that if you've been fully vaccinated, you will very likely be protected from serious clinical symptoms and hospitalizations and death from the virus, but it will not protect you from carrying the infection with few or little or no symptoms. This is important because that means that while you won't get very sick if you're vaccinated, you still may be a carrier that will make it a problem for people who are vulnerable, which includes people who are older, people with pre-existing conditions, people with immune suppression, and so on. So this is an important new piece of data that is telling us that we must take extra precautions whether you're vaccinated or not in terms of keeping your masks on indoors and keeping your distance and so on. So the fight is still ongoing and it's changing, and we're just going to have to accept the new data as stimulating changes or differences in guidelines over what we were dealing with just weeks ago.
Dr. Saag, you were in Alabama, the state with the lowest vaccination rate, and you wrote a piece in the Washington Post about the misinformation that your patients are encountering. What types of efforts are you seeing to break through?
Well, we're struggling, and I think a lot of the country is as well. That misinformation is everywhere. And to me, with this new information that we just reviewed, I think we're facing a Class 5 hurricane approaching us in a major way right now that we're not able to really comprehend just yet. Our projections, at least in Alabama, is that we, by Labor Day, will be 2 to 3 times our highest number of cases that we've ever seen. And the public isn't ready for that. You put that together with a virus that's ridiculously easy to transmit, and now this information about transmission even among vaccinated people, we have got to go back to standards of public health prevention, mitigation, which includes mandating masks. When a governor or public official takes that off the table, it's like sending us into war without our full armament of opportunities. So we have to do something to reach the public and overcome the misinformation.
A war, a hurricane, you have really laid it out there. Dr. Redlener, in the last hour, CDC Director Dr. Walensky was on Fox and shared more of what the Biden administration is looking at. Let's take a listen.
Are you for mandating a vaccine on a federal level?
That's something that I think the administration is looking into. It's something that I think we're looking to see approval of from the vaccine. Overall, I think in general, I am all for more vaccination. But I have nothing further to say on that except that we're looking into those policies. And quite honestly, as people are doing that locally, those are individual local decisions as well.
Dr. Redlener, is that what it's going to take? Is that even possible?
No, it's not possible. The federal government simply cannot mandate vaccinations for people. That can't be done. That would have to be done on a state and local level. That is not going to happen in many of our states. So I think we can basically forget about that. It's knocking our head against the wall. So what we can hope for, though, is like 1,000 points of vaccination where companies, universities, people who put on events say, you're not coming in the door here unless you're vaccinated and can prove it. And the other thing I just want to say quickly, Alicia, is that we're out of the public health agenda now. We're into crazy land with people not getting vaccinated because they're afraid that we're going to put microchips in them or that they'll become magnetic. It's out of control, and it's not really a question for the public health people. We're saying over and over again, everyone is get vaccinated. Obviously, we need to get vaccinated, but that's not the field that we're playing on here. We're playing on something very bizarre and unprecedented in American society, and it's going to take other kinds of expertise besides the people that deal in public health, as well-meaning as we are, but we have going to have to break through on another political or ideological level. But in the meantime, I'm urging companies, schools, businesses, please say no entry unless you've been vaccinated and can prove it.
Dr. Sack, I want you to take a listen to what Florida Governor Ron DeSantis has planned for Florida schools. Listen.
I'll be signing an executive order which directs the Florida Department of Education and Department of Health to issue emergency rules protecting the rights of parents to make this decision about wearing masks for their children. We think that that's the most fair way to do it. You know, I have young kids. My wife and I are not going to do the mask with the kids. We never have. I want to see my kids smiling. I want them having fun.
Dr. Sack, what happens if all these kids go to school, no masks? I mean, you were on the forefront of this in the hospital. Schools are about to reopen. Parents like me are wondering what we're supposed to do with our kids. Does this just actually allow for more confusion? Dr. Sack?
Oh, sorry. So, yes, I think the problem is with what Governor DeSantis just said. What he did is basically he's putting out there children at risk. Now, what's different about this Delta virus is that it is having more illness in kids. At our children's hospital, for the first time, we're seeing children admitted with COVID pneumonia, and some of them are going on to ventilators. So, in essence, by taking away the opportunity to mandate masks, he's basically throwing children and caution to the wind and putting them in harm's way. This, I think, should be questioned, and all it's going to take is a few kids in Florida to go into the hospital and die, and we'll look back and say, okay, your executive order is leading to the unnecessary deaths that would be otherwise preventable in children in your state. Is that the legacy that you really want to leave behind?
Nobody wants to see that, Dr. Redlener. Given this news, it's becoming more clear that this is a virus that wants to mutate. We've seen reports on how unvaccinated clusters allow more dangerous variants to form. It would seem to me that the stakes for getting people vaccinated have risen, and the challenge for how to message on this has only gotten harder. Just today, Ben Wakana of the White House COVID-19 response team tweeted in all caps, "Vaccinated people do not transmit the virus at the same rates as unvaccinated people. And if you fail to include that context, you're doing it wrong," which, of course, contradicts the leaked document we saw from the CDC. How do you square those two things?
Yeah, how do you square it? It's right, Alicia. But the thing of it is that we know for a fact that vaccinated people and unvaccinated people can carry a heavy load of this virus. There's no question about it. Are there going to be nuances and differences? We'll see. But in the meantime, like Doctor was just saying, we are actually seeing a reckless abandonment of common sense guidelines. It is unspeakable that a governor of a state like Florida is forbidding the mandating of a vaccine or wearing masks. I just don't know what he's thinking, but it is profoundly ignorant and dangerous. And hopefully the people of his state will realize before that outcome of losing children to this virus actually becomes visible in Florida or anywhere else. But we're at a real turning point here, and people have to kind of begin to take this seriously. And if the government won't, like I said earlier, it's up to businesses and organizations, universities to say, you can't come in unless you're vaccinated.
Dr. Sack, I have about 30 seconds left, but your sense of the incentives that would actually work to get people vaccinated?
Yeah, it sort of blows my mind a little bit that preserving your health and protecting yourself isn't incentive enough. But I think we need to take off the gloves, no hold barred, that we go out and we find people where they live, find out why they are hesitant to be vaccinated, and do what we have to do to get them into vaccine centers. But in the meantime, we really need to mask up right now. If you're vaccinated or not, this is a new ballgame. It's a new virus. We have to apply the old rules to this situation.
Dr. Redlin or Dr. Sack, thank you both so much for your time.
In Arkansas, the pace of vaccinations is struggling to stay ahead of the pace of people getting so sick they need hospital care. The state is reporting a record high number of new cases, numbers not seen since last winter. One of the most troubling new trends is the number of children that are now in the hospital. CNN's Martin Savage has more.
Vaccine backlash.
There's no evidence that the COVID...
No, and that's been the data, This social media post shows angry Arkansas residents shouting down a state health expert attempting to refute misinformation about coronavirus vaccines. You don't need to yell, I'll give you the microphone. Community meetings like these are meant to boost the state's lagging vaccination rates. Despite the confrontation, Governor Asa Hutchinson says vaccinations are up.
We've had a 40% increase in people getting the doses.
That might sound good, but it still means only about 40% of the state's population is fully vaccinated. Meanwhile, COVID-19 hospitalizations have been rising daily over the past 3 weeks. The last time the state's ICUs had this many COVID patients was January. But one Little Rock hospital has never had so many COVID-19 patients. Arkansas Children's Hospital.
So throughout the pandemic, this is the worst you've seen?
This is the worst we've seen for kids, yeah, absolutely.
Half of the hospital's young COVID patients are in the pediatric intensive care unit. At least 2 are on ventilators.
When a child comes into your unit, do you question the parents and say, have you been vaccinated?
We do ask.
And what do you find?
We find that often they're not vaccinated.
And if their child's here, does it change that parent's mind on the vaccine?
Oh, absolutely. We've seen that multiple instances where they wish they'd gotten their child vaccinated.
Sick children are a troubling trend, but in Arkansas, COVID-19 is killing far more adults needlessly.
I'm angry that she didn't get vaccinated, and I personally feel guilty that I didn't try harder.
63-year-old Kim McGinn, her daughter says, loved her life and everyone in it, especially her grandkids.
She worked out 5 days a week with a personal trainer. She loved to go to concerts. She loved to go out to eat.
Then came the fever, the sore throat, the diagnosis, the ICU, the ventilator, and the end. This is a photo of that moment.
This is the point where I bring up and say, she wasn't vaccinated.
She was not.
What reasons did she give?
Not good ones, in my opinion.
Her father was also unvaccinated, and that's where Rachel drew the line.
I broke down on his front porch one day after going to visit my mom in the ICU, and I just told him, I said, I'm not doing this again. You need to get vaccinated. I'm not doing this again. I'm not going through this again.
He did. As for her mother, all Rachel has left is a phone full of photos and videos, grief, and a lot of guilt.
I think I'll always feel like I could have tried harder to convince her.
Rachel is speaking out, she says, because she wants those who have not been vaccinated to realize how selfish it is, because when they get sick and when they die, all of the heartbreak, all of the hardship falls on the families, and they're literally left holding the bag. Her mom didn't have a will. Getting back to Arkansas Children's Hospital, good news, there are 5 less children with COVID in the hospital. That's today. The numbers fluctuate. They still are seeing about 50% more since the previous week when it comes to children. It used to be that children were not thought to be a concern for coronavirus, but the doctors here say the Delta variant has changed all of that. They are getting very sick. Half of the children there were age eligible to be vaccinated, but their parents didn't make it happen. Okay.